I always start my lecture with a discussion-inducing scenario, always like that. So let's say, for example, you are driving in a highway, and suddenly you hear the squeaking sound. Probably it happened to you, right? So what happened here? What the squeaking sound is? So I ask the students, what's the cause of that? So one of them will say, I don't know. So the others will say, maybe a piece of gravel, I got stuck in the wheel. So the third one, like maybe more technical, I would say the brake calipers have seized. So, but like you ask them, like, how did you know that? Like, do you have enough information to answer for sure that what is the cause of that squeaking sound? So what information do you need to be sure about that? So that information that you need is actually the core of my lecture for that day. So now they get engaged, get excited to hear me, what I'm supposed to say. One other question too. So like now you know the cause. So what else do you need? So like what are you gonna do? Are you gonna keep driving? Yeah, because nothing serious. Or you're gonna like pull over and then decide to call roadside assistance because it's dangerous. So I teach them like the clinical decision-making skills, decision-making, critical thinking skills, in addition for them being engaged. So what other things too the students love is the relevance to real life practice. So students love to link what they learn to the real life practice, which is in my area, we call it clinical relevance. So like why I'm doing this, why I'm learning this. So if some students, if they don't see that relevance, they might feel less motivated to learn about this subject matter. So I'll give you an example. One of the courses that I teach, it's about pharmacokinetics. I teach pharmacokinetics. What's pharmacokinetics? Pharmaco means like a drug or a medication. Kinetic means a motion. So the motion of the drug in the body like gets absorbed, does its thing, and then gets eliminated from the body. It does involve lots of equations and numbers, and students like get lost in that. Like, why I'm learning that? All these numbers. So what I will do, I give them lots of examples, real life patient examples, and trying to use these numbers to treat those patients. And they'll get it, and they appreciate that, appreciating the biological relevance behind those numbers. So, but like now, like my lecture is all about questions, scenarios. Students will get tired answering my questions. So like we need to address all students with different learning styles. Like there are usually three main learning styles. We have the visual learners, right? Visual learners are the learners that you like to see things. So this is where my PowerPoint presentation comes in, right? Videos, pictures. And also we have the verbal learners. The verbal ones like who like to listen to me, right? Like talking. So like this is my talking kicks in. But there is a third type of learners. We call it the kinesthetic learner. Kinesthetic learner means the ones that like to do things rather than listening or even seeing stuff. So those ones, like I give them the scenario, hands-on activity. They like to learn that way. So in my lecture, I usually address those three kinds of learners in order to achieve my learning goals. So what are other tips that I can provide here? So important thing is you maintain your tone variation. You have to change your tones. I like to changing my tones. Pauses, just pause. You see, everyone like looking at me. So because I'm pausing. So why he's pausing? Is he looking at me? Are you gonna answer me a question? So ask question. Probably if you are teaching a large crowd, probably they look down. I'm not going to answer it. But like they're going to be awake when you ask that question because they want to think, okay, if you're going to pick me, right? So tone variation, maintaining eye contact with the audience is a great thing. I usually do that. Finally, I just want to say, like my main goal of teaching is just not improve learning of the students, but also to make a difference in their lifelong professional skills, which is, I think, the most wonderful reward of teaching. Thank you. 4 seconds.